right, hi guys. We're going to do some pelvic floor relaxation meditation work. So the best way to set ourselves up is semi-reclined. So here I'm putting 3 or 4 pillows behind me and then one right here under my knees. You could be doing this with hand-on feedback directly on the pelvic floor muscles. You could do this with hand-on feedback on the belly and on the chest, or you could be doing some of this along with some belly massage. So we're going to guide you through kind of all of those different options and setups, and then we'll lead you into the actual meditation part. So first option is if we're doing belly massage. For belly massage, we do not want a lot of lotion on our abdomen because we actually want the friction between our hand and our skin. If you are during active radiation or chemo and your skin health is subpar, shall we say, then you could use a little bit of lotion, but hopefully we'll have talked about that in the clinic together. Now, for the belly massage, you're going to start off with what I call sunflower massage, which is circular massage all the way around the abdomen in a clockwise direction. When I do these individual circles, my fingers move with the skin. They're not gliding on top of the skin, but they're securing the skin downward, and they're moving that piece all around in one circle. When I finish the circle, I lessen my pressure and I move to a new spot about an inch away and I repeat a second circle. The lightest pressure helps mobilize the superficial skin or the layers of the skin closest to the outside of our body. Deeper pressure starts to approximate the fascia and the muscles, and deeper still starts to approximate the fascia between the muscles and the organs. All of that is beneficial. All of these sensory nerves and motor nerves that come in to the abdomen, the sensory nerves that head in to the digestive system, so many of them are coming from the side body here and then diving down. The enteric nervous system is the fancy name for all of the nerves inside of our gut, and it's phenomenal. 600 million nerves. That's a lot. But there's also other sensory and motor nerves that are coming superficially up here, and if we can help any of them function better, our pelvic complaint, be it leaks, prolapse pressure, pain, digestion issues, is going to improve. So that's pretty cool. So we start off with just the mechanics of it, doing these circular massage, loosening the levels, tuning in to what you are feeling. Never at any point should any of this be uncomfortable or feel like you're getting stabbed with a knife. Not allowed. You might notice, oh, it's easy for me to come up my right side, but then as I try to go from my right to my left, or from the top to the bottom, it's a little sludgy, like I'm trying to go through mud. That's interesting. I currently do not have a pelvic complaint, but if I did, that would be interesting to me to see if by doing this belly massage nightly, or at least 3 times a week, over the next 2 to 4 weeks, if I notice an improvement in my pelvic complaint as that region softens. Following the sunflower massage, if we do have a known scar that is 8 weeks or older, we can go to that specific scar and put finger on it, whether it's an appendectomy scar, a gallbladder scar, a C-section scar, or a bowel obstruction scar. Put our hands over that scar very gently and ask, how does the scar move up and down? So our hand's on the scar and the whole scar is moving up and down, okay? How does it move side to side. What about diagonals? Lower left to upper right, lower right to upper left. You could keep a little notepad if you wanted and just note that for right now. Then we're not going to treat it just yet. We're just noting. Then we're going to take our flat hand and put it right over our belly button. If a partner's helping, they can do this. Let's start with the gentlest of pressure, just moving the skin. You're going to move the skin to the left and to the right. Left and right. One direction will likely be easier. And what that means is one direction might either move farther or feel softer at the end. And for me, when I go to the right, still doesn't move too far, but there's a little bit of a spring. And then I try to go to the left, and it's like a brick wall. Like it just stops. Fascinating. If you don't notice a clear difference left to right, try up and down or a diagonal until you notice a clear difference. Once you find a direction that has a clear difference side to side, you are going to do what's very technically called smushing into ease. You're going to gently go. So for me, I went to the right and it was okay. I went to the left, it just stopped. So I'm going to smush into ease. I'm going to take up that slack, go to the right side, go the direction that the tissues wanted to go. And now I'm going to hold this smushing for minutes, not seconds, while I practice either my big three or a mindfulness meditation. The rationale behind this prolonged smushing is it's a technique to address the fascia of the abdomen specifically. Fascia is like a connective tissue inside our body, and it's like long underwear that just is continuous through our whole body. And it's around in between our muscles and it's around in between our organs. But the fascia in my leg is very different than the fascia in my belly. So if I wanted to work on the fascia of my leg and it was tight, if you've ever been to a rolfer, they can dig in on that sucker and scrape, and it really could be extremely beneficial to your leg. If you dug into the fascia of your abdomen in general, especially if you currently have a pelvic complaint, that could signal a warning sign in your brain that things are unsafe and somebody's trying to stab you in the liver. So when you're doing this to yourself, we're doing a gentle, prolonged hold and smush into ease. We're taking the fascia in the direction that it's willing to go. And we're saying, hey friend, thanks for all the work and stiffness you've been creating. I appreciate it. We're safe now and you can let go. Really cool. Fascia and the other connective tissue, they have the ability to change length and resistance, not as much as a muscle does, but it still changes from being real stiff to being looser. And oftentimes when we have a recurrent pattern of tightness, like in our IT band, it's not because our brain's trying to cause us a problem. It's because the brain senses weakness someplace else, like our quads and our butt, and the brain's creating stiffness in that IT band to kind of compensate and to keep us safe. So thanks, brain. In the tummy, we'll see the same thing. Let's say we've been super constipated or having pelvic pain or having leaks or urgency for years. That's concerning to us, right? And the brain's worried about that. And to try to protect us, it ignores the abdomen and the pelvis. That's actually not helpful because now it's ignoring all this supportive musculature and we get weaker. And so the brain's like, well, I know, let's just tighten the fascia. But it doesn't really help. So we're starting to correct all of that here in the pelvic floor method. And this gentle smushing into ease is the first step. Okay, that was a lot of science, right? Pause here for a moment, because that was a couple minutes, and go ahead and go back to your little side. Decide, do you feel a difference? I actually do. It's not perfect yet, but it's way easier to go to the right. And now, even though my direction to the left is still stiffer than the right, I can move a centimeter or so. Cool. Let's repeat that now, up or down, or on a diagonal. So one different direction, still with this light pressure. I'm going to go up and then down. Oh, my Lanta. My superficial stuff is tight. So I'm going up. It's okay, not awesome. Going down. Okay, not awesome, but a little easier. So down is where I'm going to smush into ease. I'm going straight down towards my pubic bone. Or if there's a big clock here, you can decide what direction is 12, what direction is 6, and you can kind of name it by a clock. Pelvic PTs love clocks. Okay, so I'm holding that smush into ease now, which for me is the downward direction. Now we're going to do the big 3. We're mobilizing all of these layers of fascia internally. The first of the big 3 is relaxed breathing. You're going to inhale and try to have no motion in your rib cage and all the motion in your lower belly. Inhale, belly gets bigger. Exhale, belly gets smaller. Inhale, belly gets bigger. Exhale, belly gets smaller. And some of us might notice that we want to breathe into our chest with this. No, no, no. The purpose of this first exercise, relaxed breathing, is to allow the diaphragm to work completely unopposed by any abdominal, butt, or pelvic muscle. And if we've been suffering from a pelvic complaint for weeks, days, months, or years, we might not be tuned in. We might be guarding and protecting, and we got all that tight fascia. So our diaphragm might not be used to the fact that, oh my gosh, it's allowed to expand down into our lower abdomen. If we've ever had a baby, think of third trimester. The baby's all up in here. The diaphragm can't expand downwards. It will not relearn that on its own unless you tell it to. So whether we are 2 weeks postpartum or 40 years postpartum, we can always train this diaphragm to work better. So inhale into your belly. Belly gets bigger. Exhale, belly gets smaller. The whole time I'm holding my gentle downward glide with my hands, smushing that abdominal fascia into ease. Inhale, belly gets bigger. Exhale, belly gets smaller. Beautiful job. Once you master having that belly move peacefully and naturally, and as you inhale, that belly kind of gets rounder in 360 degrees. Then I want you to tune your attention to your pelvic floor muscles. They go from your pubic bone in front all the way down to your tailbone in back. On the inside, they are a full hammock along the bottom of this bikini or Speedo area. So hold your smush into ease with this hand. With your next inhale, relax your hips, relax your crotch. And as you inhale and as the belly gets bigger, the pelvic floor muscles should blossom. There's an airplane flying by. Inhale, and the muscles around the urethra, vag, and rectum soften and open. Exhale, can you keep those pelvic floor muscles soft? Even if we're semi-reclined, that Speedo or bikini area is kind of near the ground, right? Inhale, can you feel the pelvic floor muscles kind of inflate like a little balloon? Go down towards the seated surface. Exhale, can you keep them soft? Beautiful, beautiful. Inhale, everything softens. Exhale, it stays soft. So this is mobilizing the tissues from a musculoskeletal perspective. We're focusing on the thing of what the muscles are doing. Good. Release that pressure and recheck. Wowie zowie. I have so much more movement after that. Wasn't that cool? Now, approximate a little deeper. And I'm still using the same arm. You're welcome to switch arms. Partner, if you're helping, we can switch arms. Holding medium pressure now. Let's go back to left and right. I'm not doing so good with my fascial mobility today. At this deeper level, which again doesn't hurt, but I'm just kind of smushing my stuff down, like maybe a ½ inch or so. I pull to the right. It's okay. I go to the left. It's like not letting me go at all. So I smush into ease. I keep this little ½ inch of pressure downwards, and I'm pulling all my tissues towards the right side, towards the side they want to go to. Beautiful. I could come back to that relaxed breath, and let's do that just for a couple of breaths. Holding this deeper pressure, inhaling, still trying to expand into the belly, into the pelvic muscles. Exhaling, belly comes back in, but do try to keep your pelvic floor muscles quiet. If you've done an internal self pelvic muscle assessment, or you've been working with the PT and you know you have a specific spot in your pelvic floor muscles that we're trying to target, you can tune into that spot right now. Inhale, soften that spot. Exhale, keep it soft. Good job. Now, the second of the big three is supported breathing. You leave your pelvic floor muscles quiet. The rectum, the vag, the urethra, they're all touching the seated surface right now. You keep that part quiet and soft, and you gently try to draw in your deepest, lowest tummy muscle. So if there's a muscle between my belly button and my pubic bone, I'm going to try to pull that deepest, lowest muscle up in towards my spine. My belt was a little too tight. I'm trying to just draw in the bottom part. Not up here. No way, Jose. That's not cool. The lowest, deepest scoop and lift, like you're hugging your bladder up towards your spine. That's preferentially recruiting your transverse abdominis and your oblique muscle. But here's the thing. Okay, we're still holding our smush. As you draw in that tummy, I do not want your pelvic floor muscles to engage. Whoa. So relax if we need to. Tune into where your pelvic floor muscles are in space. And we just draw in the deepest, lowest tummy without clenching the rectum, without clenching the vag or the urethra. Super hard, right? If that's too much to start, then simply just focus on gently drawing the tummy up and in and breathe. So tummy stays drawn in as we inhale, and our inhale is no longer into our belly because we've engaged the muscles. So now this diaphragm has some resistance, right? Now our inhale is kind of into our bra line or just beneath our nipple line. We breathe into this lowest third of our lungs. Tummy is tight, but we breathe in and our lungs get bigger and our rib cage gets bigger front to back. Tummy stays tight as we exhale, and our ribs kind of come back together. Tummy is tight. We inhale, our ribs expand side to side. Tummy stays tight as we exhale. And the whole time, my jaw and my throat and my neck is totally relaxed. Abs are engaged while we're breathing. Eventually, abs are engaged. We're breathing, and our rectum is totally quiet. Big goals to work towards. This is training your brain that your it's still diaphragmatic breathing actually, but it's just supported. Now our tummy muscles are firing, and this is how we live our life most of the time. So it's training our brain in a new way to coordinate these muscles for easy tasks. And this is important because most of us are not doing this phenomenally if we're having a pelvic complaint, whether it's leaks or pains. But even if you're doing this okay in real life, if we're trying to re-educate the muscles and the nerves of the core, we need to give it some regular input and some reason to change. So really focusing on this. Hey brain, did you know you should be able to tighten the tummy while we still breathe? Ooh. Did you know you should be able to tighten the tummy and keep your pelvic floor relaxed with easy things? That's fascinating. Gives the brain a reason to change. I just had a huge release and I felt my hand go like vroom, another centimeter to the side. So cool. So we practice this supported breath at whatever level is challenging 2 or 3 different times a day, and once a day, or at least 3 times a week with this smushing here. Pretty cool, right? Okay, pause, and we can check that glide again. And I have so much more motion side to side. So neat. Let's do one final direction for our last of the big 3. And you could choose to just hold the same smush for the entire duration of these big 3. I just want to guide you through and give you some variety. So for my last direction, I'm still going to have that 1/2 inch pressure, my belly button down towards my spine. And now I'm going to try to go down and up. And this one is the most clear for me. Up doesn't want to go. Oh, no, I lied. Down doesn't want to go. Up is okay. So I'm smushing into ease in an upward direction. Now my treating arm is starting to get tired. So I'm actually going to switch to my other arm. You might need 2 hands. Your arm might be tired. You might do the last one without a smush. That's fine. But I'm holding the smush into ease. For me, this time it's straight upwards. And my final of the big 3 is my Kegel and relax, whatever version we've been instructed in. I'm going to guide you through the versions as they get progressively more complex. The easiest version is just the pelvic floor bias. So I'm holding my smush into ease, and I am simply going to try to take my pelvic floor muscles from their resting position. I'm going to try to squeeze and lift my rectum, squeeze and lift my vag, squeeze and lift the urethra. Hold it for about 3, 2, 1. Here's the more important part. Relax all of those muscles. Yeah. You can picture this fascia, this long underwear that's kind of going from where my hand is, and I'm smushing it in to ease, but there's a little tension on it. And now I'm adding the pelvic muscle lift and relax. It's mobilizing all of those internal tissues between where my hand is and the pelvic floor. So cool. Again, squeeze and lift up. Rectum, vag, urethra, everything dynamically squeezes and lifts. Tailbone comes towards your pubic bone. 2, 1, and then relax it further. Relax it all the way back down to that seated surface. Good job. You're going to do a total of at least 5. If that part is challenging for you, I want you to just stay with just the Kegel. If you're ready for a little bit more, and you did fairly well in the last exercise in the supported breath, you can come along with me to the pelvic floor perfect Kegel. Step 1, pelvic floor is quiet, just the deep lower abdomen engages. The pelvic floor stays down on the seated surface. Now add your Kegel. Rectum, vag, and urethra squeeze and lift away from the seated surface. Hold it for 3, 2, 1. Keep your tummy tight and relax just your pelvic floor muscles back down. And relax your tummy. Take a couple belly breaths if we need to ensure that the pelvic floor comes all the way back down to its normal resting tone. And let's repeat that again. Tummy first. Pelvic floor stays quiet. Add your Kegel. Squeeze and lift rectum, vag, and urethra for 3, 2, 1. Keep your tummy tight. Relax the pelvic floor muscles all the way back down. And then relax your tummy. Beautiful job. And you would do 3 to 5 of those Kegels, mobilizing all of these tissues. Now that we're done, we should have a whole lot more passive mobility throughout the entire abdomen. And we are set up for success because before, with all of that stiffness, that was a lot of work that your tummy muscles and your body muscles had to try to do to move all this fascia. Now you're going to be able to work smarter, not harder, which is great. If we're doing this right before bed, that massage also activates our parasympathetic nervous system for rest and digest. So it can help move poop along a little bit more evenly, which helps slow poops and fast poops kind of come back to the middle ground, which is great. The last bit of the belly massage is colic massage, or massaging the colon itself. But please understand that you're not actually going to be on your colon. Your colon is really far back behind you. But you are mobilizing a ton of nerves that go to the colon and control its movements. So you're doing a lot of good. I am going to cue you in visualizations that we're moving the poop along. But again, we're mostly moving the structures above it. But it's still I said pooper effective, super effective. When I learned this, oh my gosh, it must have been in 2010 at a continuing education course. I didn't think I was constipated at all, but I did this the first time and I pooped every 2 or 3 hours for like a day. It was crazy. And then my poop has been like the best of my life ever since, including after kids. So I highly recommend it. Okay, actual colic massage. The first step is to help the poop come through the sigmoid colon, which is this last like 290-degree turns that it has to make. It's kind of like holding place before we let it out. So we find our deep left hip bone, we relax our belly, we push down, straight down, and then I pull inwards towards a space between my belly button and my pubic bone, and then I release. Now pressure. I can push pretty deep because everything's fine. This does not hurt. If that's painful to you, any amount of pressure is better than none. So please do not engage a really painful barrier. Just push as long as you can do the motion comfortably. 3 to 4 pulls, pushing straight down, coming across towards the midline. For this one, your fingers will slide against the top of the skin. So don't give yourself a rug burn or anything, but make sure that we are moving a little bit with this one. After 3 to 4 to start to move the poop across the sigmoid colon, then you're going to come here to the descending colon, just beneath your left rib cage. Moderate pressure, pushing straight down toward your hip, and then releasing. Come to the top. And if this is my midline and this is my total side seam, I'm like halfway to 2/3 to the outer border, so like right underneath like this rib here. Yeah. Pushing straight down. This part is stiff for me. Wow. Can't wait to see how I poop later today. And one more. Beautiful. 3 to 5 downward glides. We skip the transverse colon because there's a lot of other stuff on top of it, and a little less sensory nerves that we are targeting exist here. We go straight to the ascending colon. So I go to my right side. Oh, I just had a big gurgle. I start by my right hip. This time I pull up. Good job. Times when I have been a little constipated, times when I've been traveling, I'll do this ascending bit and I'll actually feel pressure on the left side as the colon gets stimulated to kind of move the stuff through. It's really a powerful technique. 3 to 5 moving upwards on the right side. And then we end with mobilizing our cecum, which is where our small intestine meets our large intestine. Oh, this one's tender for me today. So my next one, I'm going to push a little less. I'm going down in my right hip, pulling towards my midline, and then back to the center. 3 to 5 times. Oh, I had an ovarian cyst rupture a couple of months ago, and I haven't done this since. That's why I have so much tenderness. This is something good for me to work on. So that has now, you've mobilized this area, made it move better, you've mobilized the nerves, and that's going to improve your ability to sense where your body is in space for your big three. It's going to improve your gastric mobility, your colic mobility, and it's going to activate your parasympathetic system for rest and digest. So that is the mechanical approach to this. The next video is going to be a little bit more of the sympathetic, parasympathetic nervous system visualization. Minimum of 3 times a week, we want to do some form of this tummy massage. You absolutely could do it nightly if we're really into it, but minimum of 3 times a week for 4 to 6 weeks to see a huge change. And I'm just super proud of you. So thanks for being here.